I'm happy to be joined now by Dr. Barbara Levy, Vice President Health Policy for ACOG. Thank you so much. We're talking about this scope certification. I think most people know what that is, but if you could give us a bit of an overview.
I hope most people know what it is. I wish they did. So SCOPE is an outpatient, basically an office certification for safety. Patient safety is such an important issue that really in medicine we've been focusing on for the last 5 or 10 years. But as more and more procedures and events are happening in offices rather than in outpatient surgery facilities or in hospitals, ACOG many years ago convened a task force to look at what are the things that an office should have in place to get the team working together to think about focusing on the patient.
Well, specifically, how do you think individual practices are going to benefit?
So I think as we're moving into a value-based payment system, if we just thought about payment, the SCOPE processes will help improve patient satisfaction. They're going to help patients feel safe in the environment. But more importantly, they help every member of the practice work together as a team. And we've focused a lot on team-based care, but the reality is everything from the moment that a patient contacts the office is critical to patient safety. We need to train the front office people or whoever receives an email to be able to triage and know when is something urgent versus not, because the woman herself may not know. And so there's the training piece, policies and procedures, mechanisms in place to just make sure that the entire practice works together for the benefit of the patient.
For physicians who are maybe a bit skeptical or maybe just thinking, I'm very good at communicating and my office staff works very well together, we are a well-oiled machine, why do we need this?
So sometimes it all works great till it doesn't. And I'll just give a little story from my practice, which was that we were working terrific and we'd been doing office-based procedures for a really long time. And as I looked at the SCOPE application, something came to mind, which was if an emergency were to occur and my nurse and I were really busy taking care of a morbidly obese patient on the table, how would I notify the rest of my team outside the room that there was an emergency going on in the room? Would my nurse have to leave and leave me trying to manage a big patient? We put in little doorbells that were not wired, just remote, and we fitted each one to where I would be in the room so that I could reach it without having to let go of a patient. Little things, but things that really make a difference.
How long does the process take?
So that'll vary depending on the practice, but we've really simplified the application. We've tried to make this streamlined and only hit those really critically important pieces that will make a difference for a practice. And I have to say that getting everyone in the practice on board to work on this together is a team building exercise in and of itself. And when we talk about physician burnout, part of the burnout is feeling like you're in conflict all the time with your EMR, with your hospital system, even with your patients who are so demanding of you. And when everybody works together as a team for the patient, it gives you that sense of doing your duty, but also giving back. And the compassion and the warmth of taking care of a patient comes back. And that's such an important piece, not only for us, but for all the members of our team, from the person who answers the phone to the nurse putting patients in the room. So that sense of camaraderie for the benefit of the patient is one of the kind of unknown benefits of the SCOPE program.
It's a win-win. Thank you so much, Dr. Levy.